Great. So the first question is about GOLD, the initiative GOLD. If you could explain us a bit what it is.
GOLD is an acronym that means Global Initiative for Obstructive Lung Disease. This is a non-profit global organization to promote research and better treatment for patients with chronic obstructive pulmonary disease, or COPD.
And how do you exactly work?
Well, as I told you, this is a global non-profit organization. It has a board of directors. I have the privilege now to be the chair of the board of directors. It has a scientific committee with members from all around the world, a dissemination committee, and we try to elaborate clinical guidelines every year, although every 5 these documents have a very, very significant revision.
What do you see as the main challenges to develop guidelines or treatments for
COPD?
Yeah, COPD.
Well, the problem is that COPD, like many other human diseases, are complex and are heterogeneous. That means that not all patients have the same functional or molecular abnormalities. And this clearly calls for a more personalized or precise approach. We need to understand the molecular basis of these diseases, and in order to do this, we need to integrate many different types of data, from clinical data, imaging, function, molecular, proteomics, genomics, so forth. So that's a challenge.
So, in your opinion, will precision medicine, if precision medicine is to develop, it will lead to better treatment of people suffering?
Oh, absolutely. I am fully convinced. I mean, that's a natural evolution.
So, can you repeat the question?
Oh, I have to repeat the question?
A little bit in the
okay.
answer.
Okay. So,
yeah.
Sure. I think that precision medicine will eventually, not now, but eventually lead to a much better treatment of many, many different human diseases, including COPD. We need to stratify the patients better based on their molecular pathology, and then we will be able to either repurpose all existing drugs for specific groups of patients or to develop new drugs.
And one of the main issues when we deal with patients and sharing of data is that they are not willing to share data. How can we overcome?
No, I don't think that patients are many patients, I would say most of them, are absolutely willing to share the data as long as they are anonymized. That's not a problem. Problem is how to put together different types of data from different institutions, how to overcome the otherwise acceptable aspirations of many scientists to analyze these data on their own. So more than patients, it's about us and it's about technology, not patients.
And how can you overcome these challenges?
Well, talking, discussing, agreeing, accepting some basic cooperative principles.
I'm not sure if you're very acquainted with eTRIKS, but do you think initiatives such as eTRIKS are a good step to overcome?
Yeah, well, I'm not very acquainted with eTRIKS. I've never used it. I think I know what eTRIKS is, and if I'm not wrong, I think that's a very good initiative, and these type of initiatives should be developed and pursued, no question.
Let's do that one more time.
Well, I'm not acquainted with eTRIKS. I've never used it, but I think I know what it is, and I agree it's a great initiative. I think this is the type of tools that we need to really moving towards precision medicine.
That's it.
Good.